All right, welcome. Well, so to kick things off, let's just do some quick introductions. Gina, Melissa, tell us who you are, a little bit about yourself, and we'll get rocking and rolling.
Thanks, Doug. I'm Gina Armer from Lilly. I work in cardiometabolic health communications on some brands you may have heard of, Mounjaro, Zepbound, and I lead policy and access communications.
Hi, everyone. I'm Melissa Gordon-Green. I am the global president of VG Media Brands Health, which is actually a center of excellence that we created across media brands to really pull together the best practices, processes, information, and talent across media brands.
Awesome. All right, cool. So I always like to start with a nice grounding question to set the stage. So I want to talk about the framing of the patient experience. What do you think today are the biggest challenges facing patients around access and affordability? And are these new, or are they just continuations of longstanding issues in the space? Gina, if you want to take it away.
Sure. So I think we heard a lot of this from Craig, right? Like people have a vast amount of distrust within the healthcare system. It's incredibly complex. It's hard to get access to certain medications. From a manufacturer perspective, we're constantly innovating and coming up with new medications, but often policy and coverage lag behind that latest science. So that really affects people getting the care and treatment that they need. And so we're really focused on how do we get the system to catch up with the latest science and innovations that we have coming down the pipeline.
I think it's a great question. I love the concept of trust. I know we talked originally that we knew that trust was going to come up. It's like my favorite thing because trust is built in increments. If anyone's a Brene Brown fan, that's a Brene Brown quote because it's built in increments that can be taken away in one fell swoop. But I think our industry is it's built on trust. Everything is built on trust. We talked about it before. But the reality is that we have to be truthful as well. And I think that we have to be transparent in the information that we're sharing and in the way that we're sharing it, right? So we think about these barriers. Are we really communicating in the right way that patients and even physicians can understand what our products are about, what our services are about, and in materials and in the platforms that are most relevant for that?
Yeah, so I feel like this is a bit of a two-way street even, right? Where it's how do we talk to the patient, but then does the patient understand? So do you feel like there's an overall sense of health literacy amongst patients, and are we meeting them in the right ways, talking to them in the right ways to encourage that? Do you want to?
Sure. I think we could be doing better, 100%. There's always opportunity, and we have to listen more. We have to listen. We have to understand what's most relevant for patients. How do they want to hear this information? Where do they want to hear this information? We've invested in a few different media trials at media brands. Like I joked, these are my passion project. That media trials through Magna. There's a ton of research in the industry. And when I got to IPG a few years ago, we'd never done anything in health, and I was like, this is a tremendous opportunity. So we've done some research specifically about where do patients want to see different types of messaging. And so they want to see a product message in social. Do they want to see a savings message in linear television? And I think we need to learn and listen more because there's so many nuances. And as channels continue to get fragmented and become more complex, we have to figure out how to put the right message at the right place at the right time, which is, golden unicorn. But we just have to listen more, do more research to find out what matters, and then break it down and start back up again.
Yeah, and I would say simplify where possible, right? Like a lot of these disease states, medications are really complicated to understand. So if someone doesn't have a high education level, how do you make it really simple for them? If English isn't a first language for them, how are we providing materials and languages that are resonating with them? Even from a cultural relevance standpoint, right? Like some disease states like obesity, one that I work in, different cultures may see that as a positive versus a health issue. So how do we really meet those people where they are and ensure that it's honoring their cultural traditions and things, but making it all about health and really that being the center. So I think it's a bit of a mix of being simple and culturally relevant.
Yeah, and you both just mentioned meeting patients where they are. So talk to me a little bit about the channels in which you activate. How do you think through the role of those channels? I know, Gina, you've done a lot in the social space. So can you talk to me some of the more newer channels, more nascent channels, and then broadly, like what is the old traditional mix looking like? How do we think about TV, print, some of those legacy channels? But if you can kind of tell us about what you're doing today in social, I think that'd be a great place to start.
Yeah. And actually, I'm going to start with the traditional because
Sure.
I think traditional has a definite role still, right? People are used to seeing information in those places. But if you think about something like earned media, for example, a lot of people are having more skepticism on reporters and outlets. So it's how do we use other channels that are more emerging to be able to get people the information that they are looking to consume. So social and digital, for example, we're still trying to figure out how do we appropriately tap these content creators and influencers, um, understanding that people want to hear from information that is relatable, from trusted sources. And we know people go to online forums for a lot of this information. So how do we appropriately tap into that? So Reddit, for example, we're doing some advertising there, but we haven't really been able to tap into the engaging conversation that's taking place. So people are talking about um, how the medication is benefiting them or coverage challenges that they're having, and how are we able to kind of insert ourselves into that conversation to really help people along the way, whether it be through adherence or coverage challenges or whatever it may be. It's still something we're trying to figure out, but I think it's really ripe for um, us to be more involved in. And then also we're looking more at podcasts. So we know a lot of people are getting their news sources. They're listening to daily podcasts. They're trusting people that they're listening to all the time. So both from an earned perspective and from a paid integration perspective, really implementing podcasts and audio more into our channel mix. So I think, we're really thinking about it holistically. It's not just, I think long gone are the days of a single channel. We have to be really robust when we're thinking about, again, how we're reaching the people at the right time.
Yeah, it sounds like you're joining the conversation where it's already happening, but finding those organic moments to make it feel very natural.
That's right. And I think, Melissa, you mentioned too about listening and being more in tune to that. So, how are we leveraging some of the social listening and what people are saying on our own channels to really tweak our own messages that we're proactively going out with and being able to serve up resources based on the conversation that's happening?
Yeah.
It's incredibly critical, and I completely agree with everything you said. And in terms of the channels, we are using all of the channels, and we have to use all of the channels, and we also have to test all of the channels. I think it's all about our audience and what we know about them and how we can understand them, obviously in a privacy and compliant way, as well as where our HCPs are and how do we find those like perfect places and intersections between the HCP and the patient. It's a perfect example of how can we find those places within those conversations and be there when it matters? Um, I do think that's long gone are the days of one channel. I was talking about flowcharts and GRPs, and people were looking at me like I had 10 heads. When I think about what it used to look like, what our world looked like, 10, 15, 20 years ago. Um, and the reality is that we have to really tie ourselves to measurability, but measurability with purpose, ensuring that we have those clear KPIs in the beginning, not just on what the plan is supposed to achieve, but what each of the channels are doing and what that role plays. And that to have them feel like they have a better experience, so that we do end up with better outcomes.
So I feel like when we have these conversations about trust and we talk about how we build it up, there's almost an unspoken question, and I'm just going to speak it, of like, where are we starting from? So do you think in broad strokes, are patients distrustful of the overall healthcare industry? Are they distrustful of the pharmaceutical industry? And if they are, how do we navigate that? How do we really meaningfully build it back up?
I think we need a whole session on this, but just for a few minutes, I think again, Craig touched on this, but it's so complex, and there's a lot of noise out there and a lot of misinformation that we're up against. He spoke to the Maha movement, right? Like some of those principles are really good in advancing the health of people, but there's also some anti-science in that too. So how do we appropriately combat some of that with the facts from trusted resources? And when we look at trusted resources, we're thinking both advocacy groups, patient advocacy groups where people people are going for trusted information on their disease states. So how do we better partner with some of those groups to put out resources that are relevant? But also, like I mentioned earlier, the influencer piece, there's a lot of trusted HCPs where people are going for information. So really trying to build up that trust in those ways. And then from a whole equity standpoint as well, how are we leveraging community-based partnerships, faith-based organizations to really, again, meet people where they are and where they're used to going for trusted information?
Yeah, I think everyone's wary at the moment. I think healthcare and pharma has been at the forefront of people in terms of distrust of an industry. And, I don't think our climate today is going to help that cause. So we have to continue to show up in the most positive ways possible, but do that as well. From coming from a place of advocacy and a place of empathy in terms of what our patients are going through, I will say though that I am a bit worried when it comes to trust, because people are putting tremendous trust in ChatGPT and Gemini and all these other places, and nothing's monitoring it. And it's frightening. To me, that's like, how do we come together also as an industry to say, okay, well, like AI is the new search, right? And who's tracking that? Who's paying attention to that? Who's ensuring that all this stuff is accurate? Because people are making actual decisions. I had heard a story recently where someone was asking a question to AI. It was like a nutritional question. My kid always tells me they're hungry. What should I feed my child to keep them full? And it said a rock. So if that doesn't frighten you, I mean, seriously, and we have to advocate too to help to ensure that patients understand that this isn't like the most legit place to get your information. And when content's coming down from the CDC, like how do we ensure that we're on top of this? Because it's really, it's only going to get a little scarier, I think, but we have to be vigilant and ensure that we also empower and advocate the people that we work with, our teams, our internal teams, to keep pushing in these areas and pushing for policy and pushing for conversation and dialogue so that we are keeping it pure, because patients don't understand. And it's our job and our tremendous responsibility and a gift for us. One of the great things that we get to do in this industry is to make an impact. We have to keep thinking about that in this more complicated world.
And not eat rocks.
And not eat rocks. Definitely don't eat rocks.
And to build off that a little bit, we know a lot of the AI is, Google Gemini, for example, pulling from YouTube. So again, with our podcast strategy, how are we getting out there more so that some of that content is feeding into some of these AI tools? So I think it's definitely something we constantly have to be thinking about pulling through.
There is AI for good. I don't want to see if that's, I don't feel positively about that, because there's a lot of things that we are utilizing in AI to move faster and more efficiently, which is amazing, because we know we want to reach more patients faster. We want people to, our patients are waiting. And we want to be able to do that, but we also have to do it for good.
So if I can ask a bit of a probing question on that, do you see a world in which AI can help empower trust, or do you view it right now as a headwind?
I mean, there's absolutely a way that it can empower trust. I mean, I talked earlier about people feeling more confident and more warm and fuzzy about ChatGPT, as a conversation versus a physician. How do we harness that? That's an insight in itself. Patients are craving something that is more attuned. I mean, it's the model is built. The agents are built specifically to take what they're hearing and translate that. Physicians aren't always trained in those types of communications, and you want your physicians to be trained in how do I practice the best medicine? How do I know what the best treatment is, the best therapy? They're not always trained in that, like listening, those more EQ qualities. And if we can kind of figure out the best way to build a bridge between that, it's a tremendous opportunity.
I think too, if you think about supporting people along like a treatment journey, right? If there's adherence issues, maybe how can we better leverage AI to track them along their journey, know when people are dropping off, and how can that help support someone along the journey? So I think there's a lot of opportunity.
Yeah, got it. So then I do want to come back to something you mentioned earlier around thinking through access in the lens of linguistic barriers, cultural barriers, or opportunities, right? And so how, when you approach your broadcasting strategies, do you weave in that targeting or weave in that mentality around meeting people where they are from a linguistic and cultural standpoint?
Yeah, so I think it's a lot about how we're communicating to people. So if we think about a disease state again, like obesity, that's highly stigmatized. People don't view themselves as having obesity, but they view themselves as knowing that they've had weight issues. So how do we leverage that insight into some of our communications when we're talking to them? We know there's been, you've had struggles with your weight. Here's some resources to help, versus pointing them into the direction of you have obesity and you have to address it. But just kind of being empathetic in this journey too, to meet them where they are. And also from a cultural standpoint, like, maybe put them in different areas, like advocacy groups that have resources on cultural foods, maybe making them in different ways and things like that to make them more helpful for them and their families. So I think there's a lot of ways that we can kind of integrate culture and empathy and, being just conscious of using person-centered language in our communications.
I completely agree. And I think content is, the best lever that we can pull in order to do that. And in this world as well, where we can create content so much faster. Obviously, we have MLR and all these other, processes and approvals that we have to go through, but we should be able to make content faster and make it more intuitive as a function of how people want to listen and want to learn. The culturally relevant piece is invaluable. I mean, we know from data and from research that if you're not speaking their language, if you're not speaking in a way, then maybe, and finding the right vocabulary is more powerful. Like, if people are overweight, they really want to hear about obesity. Like, what have you learned? We say it in a different way, but creating and optimizing that content is a critical piece in making sure that that connection is powerful.
I I would also add to this, it's not just about how you're talking to the consumers, but how you're educating HCPs. So, there's a lot of HCPs haven't gone through training on bias and stigma, for example. So when they're addressing someone that is having weight issues, how are they approaching that from an empathetic standpoint? So that's something that we're really conscious of when we're talking about education and language, and also how we're educating healthcare providers.
Got it. So then I do want to just switch gears a little bit. It's all part of this holistic conversation on trust, right? Is the side of affordability. It's one of the big barriers. It's certainly a feeder into patient trust. How does value play a role in your overall approach to patient marketing, to HCP marketing? Like, what is your stance there?
I think value is a huge importance, right? And when people think value, they always think about cost, right? That's where everyone goes. And I think it's so important to understand that the value of a treatment is more than just the cost, more than just the face value. It's about the health benefits, about the long-term health benefits. It's about some of the intangible benefits that people have from being on medication, how they've been able to keep their life back or keep their health back. And also some of the quality of life things that are again not on label, not perfect from a compliance standpoint, but really important to a person. And so we really try to tap into that through our storytelling efforts. Talking about what it's meant to somebody to be able to get up, walk up and down the stairs and play with their kids for the first time, or walk their uh, daughter down the aisle for her wedding. Like what that actually means to somebody from a storytelling perspective is something we really try to harness and bring into the value conversation.
Um, Value can mean something different to every single person. I think it's similar to like innovation. What does that actually mean, unless you're thinking about how it relates to you or your product or your client? Um, but I think value is different for everyone, and we have to figure out what that actually means, and take it through the entire kind of patient journey. Because value can be different from diagnosis to actual treatment to adherence, and the financial piece is getting even more complicated. And you're right, that's absolutely the first place that people go. But we have to highlight the therapy and the products and the brands in a way that tells a little bit more about the value that it brings overall. And I say this all the time in terms of anytime I'm talking about health, I feel like we have a unique position and that our job is to help people feel a little bit more in control of something that they don't have control over, right? You don't get a choice. We lots of conversation this morning about things happen to you and you have to deal with it. But we can give patients more of a choice and physicians more of a choice. There's value in that. So we have to figure out kind of and almost prioritize what does that value look like, and how can we build on that as we solidify and cultivate those relationships with our patients and our physicians.
Awesome. So I do want to, we're a little 10 times, so I want to ask my final question, then we'll move into Q&A. What do you view as the overall future of a more patient-centric approach to marketing? And how can we today, as marketers across healthcare industry, across pharmaceutical, better prepare for that future?
I think we've talked about it a little bit today. Craig's also talked about it, but just the idea of being more personalized to people along their journeys. Again, serving up information that they want to see in the places and ways they want to see it. I think that's the future. I think, we're coming traditionally in healthcare, we haven't been very consumer focused, consumer minded. And so we're really trying to learn from a lot of the top consumer brands on how are they communicating and building advocates, along the way, and what are some of those learnings that we can leverage to also be more consumer driven. So I think personalization is definitely a key.
I think the future is all about access, and I love it. That's part of our topic for today, but it's also not just about access and like afford a product, but access to even seeing physicians or getting the right treatment. I love some of the things that I saw in CES in terms of AI was incredibly helpful. When you think about patients who are living in super rural areas and they were like building these pods that literally can give you an entire physical exam that you virtually speak with a doctor and you step on something that can do all of the diagnostics and you like plug yourself in. And I mean, it's incredible. So I think the future is better healthcare for all. And that's pretty exciting.
Yeah, and regardless of where you are, you start to have these expanded options.
It's breaking down barriers. And that's the thing that we need to do and continue to push ourselves as well. I think we work in healthcare for a reason. I've been working in healthcare like 95% of my entire career, and it always brings me back. I'll try something else. And it's like, no, I gotta go back. Um, and I think that we have the opportunity to really make an impact. If we can do that for more people, there's just tremendous opportunity.
Awesome. Well, thank you both. I really appreciate it. And we'll turn this over to the crowd.
You're so good. You're perfect.
Not too bad. All right. What questions do we have from Melissa and Gina?
Now everyone's awake to ask some questions.
Go.
All right.
Coffee's kicking in.
Hi, Ilona Retalk from Spectrum Science. So we talked a lot about influencers and whether they're just influencers or celebrity influencers. What do you think? What type of impact do you think they have on trust in your brands? And if you ever leveraged them for your marketing campaigns, what type of results have you seen?
So we haven't done too much on the celebrity side with our disease states, but as we're looking at the content creators, we know people are going to those trusted resources, and actually, believing everything they're saying. A lot of them are credible. They're physicians. They're people just with lived experiences that are relatable. So we know that there is trust to be built there, and it's definitely something that we've started. Exploring, but haven't fully tapped into the potential of yet.
We use it across the board. I think it's when you think about when you're following someone, it may be just a very small effort in order to do so, but they're actually taking action. So they're leaning in to listen to whatever this person has to say, and we see tremendous results. And I think it's incredibly important too when we're working with our diverse minority, audiences that we really leverage influencer in a way that is surprising and has really shown some very positive outcomes.
Hi, Michelle Lenzo, Celery. Really interesting discussion. Thank you. Melissa, earlier you talked about the media trials that you hosted. And could you talk a little bit about those trials, some of the learnings, and how you applied those to your media campaigns?
Thank you for this question. I love it. Thank you. We actually completed our third media trial within health, but we've done two. One was specific to where people actually want to see pharma messaging, and the message myself. We did that actually in conjunction with a partner, and it was incredible. It really was very intuitive, so there wasn't tremendous surprises, but there were a few ahas when it came to those specific, like people want to see a savings message in social, which is, it's, like, I want to talk about savings, but it was very powerful and interesting to see that there's so many specific nuances. The other one that we fielded specifically around the power and the impact of pharma messaging and marketing overall. Do patients like it? Do physicians like it? And I'll tell you right now, when I saw the data, we spoke with over 1,000 patients and 1,000 physicians. Over 92% of physicians appreciate and are grateful, feel positively about pharma marketing and pharma advertising. And as we looked down and drilled down to the different audiences, the different age segments, we saw that more diverse audiences actually felt that pharma marketing, pharma messaging was more helpful to them than other audiences, which to me also is like tremendously impactful. So use that stat for anyone who wants to lock in some more diverse spending, especially in the world that we're living in at the moment. But it was so interesting as we were really trying to solve for something. And we're always, if anyone has ideas, let me know because we're always looking to do more. But these are things that help every single one of us in this room to learn more about. So I can share if anyone has questions about it.
Last question over here.
Good morning. My name is Drew White. I'm with GoodRx. And access and affordability is a big topic for us. It's one that we think about a lot. We see roughly 1 billion scripts abandoned every year, largely due to price. And so I just wanted to ask how you think about incorporating price affordability into your overall communication strategy, both for the HCP and the consumer journeys.
I would say one, I think from an HCP perspective, it's really educating on the landscape because some people think there's more of a dire situation than there really is. So that sometimes prevents healthcare providers from writing prescriptions. So it's about how we enable our sales team to have those conversations with the providers. And then on the consumer side, I think it's educating on other options that are available to them, whether it's patient assistance programs. Lilly also has self-pay cash options. So just educating that there are other options beyond just your traditional channel.
Yeah, I mean, once again, it's like the right time, but also giving people the option to tap into that information. So, really making it more engaging, creative, especially on the digital side, that allows patients to lean in because they have to be ready to have that payment and pricing conversation too. But it's an important one, and 1 billion scripts is a lot of scripts. And that's it. Thank you. That's a great stat. So we just, we have to be very cognizant of that because the messaging about pricing is critical. It's can be the hugest barrier to actual treatment.
Just one other thing too that I wanted to mention is I can talk about this all day long, so you can come find me later. But I think it's also about how do we turn some of these patients that we're talking to into advocates as well. So especially in the obesity space, there's a lot of policy, there's a lot of bills that are out there. So how do we enable them to contact their legislator? So I think there's other ways beyond just the medicines that can get people to take control of their health and let them know that they have a voice in this as well. So it's really turning them into advocates at times too.
Melissa, Gina, Doug, thank you guys so much.